My name is Vivian Schiller, and I'm the Executive Director of Aspen Digital, a program of the Aspen Institute. We focus on media and technology. Really want to thank you for joining us all today. We are welcoming a broad range of attendees from the public policy and government world, the corporate sector, civic organizations, educational institutions, media, and of course, Aspen Institute staff. We hope that you are all safe and keeping yourselves and your loved ones healthy. As you can see, or as you can see from me, and you'll see the others too, we're coming to you from our homes through the magic of technology. Just keep in mind that that same technology can glitch, so really appreciate you bearing with us if that happens. The last few weeks have seen some of the most fast-moving developments of our lifetime with absolutely no end in sight. Clear and accurate information has never been more important. It is no overstatement to say that this is a matter of life and death. And yet the misinformation is at full play. Of course, the misinformation crisis, it predates the pandemic. This has been something that many of us have been dealing with for many years, and misinformation, frankly, has been around for millennia. But it is most urgent now. In this webinar, we're going to talk to you about the contours of the so-called infodemic and what we can do about it to make sure that critical information reaches its intended audience. We are very lucky to have with us Dr. Claire Wardle, who is one of the most foremost experts on information tracking and verification across platforms. She is the co-founder of First Draft, a not-for-profit which is solely focused on misinformation. They conduct research and develop fantastic resources. And while I normally wouldn't offer this disclaimer, I should mention that when I say Dr. Claire Wardle, I mean the PhD kind. I do not believe she's going to be dispensing any medical advice. At least I hope not. After Claire does her presentation, we'll be joined by CNN reporter Donie O'Sullivan. Donie covers the intersection of technology and politics and does really some incredible investigations into online disinformation campaigns. He's got some great reporting on the infodemic just in the last few days. The three of us will chat for a few minutes, and then we'll turn it over to your questions. If you look at the bottom of your screen right now, you will see a Q&A button. From there, if you click on that, you can then type out your question. And if you are comfortable doing so, please include your name and affiliation. It's just really helpful to hear where you're coming from. Please know we may not get to all of your questions, but we'll get through as many as we can. And you can put those in anytime. You can put questions in now. You don't have to wait until the Q&A section. So with that, I will be joined now by Claire Wardle. She's coming on any second.
Hi, Vivian.
Hi, Claire. It's so good to see you.
Thanks for inviting me.
Thank you for joining us from your home. And so now I'm going to turn it over to you so you can do your thing, and I'll see you on the other side.
Great. Thanks, Vivian. And I just put together a few slides because I'm going to talk about some visuals, and it makes it much easier if people can actually see what I'm talking about. So my name is Claire Wardle, and I founded First Draft about 4 years ago as a resource to help journalists tackle these questions about how do you verify material online. It's now, as you all know, become much more pressing. We do projects in the field, we do research, and we do lots of training, which increasingly is now on webinars. So just to give you kind of the things I'm going to run through in the next 20 minutes, that's all. I'm going to talk about the terminology and why it matters. I'm going to talk some of the trends that we're seeing. I have a team of 10, and they are spending all day right now monitoring social media, looking for misinformation. And I'm going to end with some actual concrete steps about best practices for slowing down misinformation. So the infodemic, it's kind of astonishing that it was only February 25th that WHO kind of started talking about the infodemic. And at the time, people called me and said, is this crazy, Claire? And I have to admit, at that point, I couldn't quite imagine how quickly this was going to unravel. But I think we now all realize that whilst, of course, lots of governments are thinking about food logistics, medical logistics, we also now to critically think about information logistics, and that's what I'm going to focus on right now. So in terms of terminology, I think just to start off with, I wanted to talk about the differences between misinformation, disinformation, and malinformation. So disinformation is false information, and the people creating and sharing it mean to cause harm. So the Russians meddling in the election, that was disinformation, but that is very different to misinformation, which is still false, but the people sharing it don't realize it's false and they don't mean any harm. And so most of what we're seeing right now is actually misinformation. And malinformation is a third category, which is genuine information that when people share it, they're doing it to cause harm. So for example, if you had a passenger list from a cruise liner and you shared that passenger list, that is genuine information, but the sharing of it is probably done to cause harm. Although right now these lines are very blurred. So a couple of years ago, I created this typology, which was the 7 types, partly because I refused to use the term fake news because it didn't grasp the complexity. And I would argue what we're seeing right now in terms of this infodemic is it's far more complex than that term that we've been talking about for the last 3 years. Because at one hand, things like satire, we see bad actors labeling things as satire deliberately to get around platform policies and to make sure that fact checkers don't touch their work, but knowing that it will then turn into misinformation because somebody will get confused and they don't realize it's satire. Things like false context, genuine imagery, but maybe it's from the SARS epidemic and it resurfaces and people think it's from today, but actually it's from 5 years ago. Or things like imposter content, when somebody takes a logo. So we're seeing this right now, flyers in LA a couple of weeks ago with the CDC logo, the WHO logo, and lots of false information about COVID that were being posted through people's letterboxes in California. And that's because our brains are, unfortunately, we've kind of got lizard brains. And so one of the things that we're constantly looking for is heuristics, which are mental shortcuts to help us understand something. And a logo, whether it's a CNN logo or it's a WHO logo, is one of the quickest ways that you can build credibility with somebody. And so no wonder we're seeing that. And we're actually seeing local news sites across the US are having their logos used again to push false information. Fabricated content, I'm actually a lot less worried about that. The biggest bucket we're seeing right now is kind of misleading content, old content resurfacing. It's not outright lies or falsehoods or conspiracies. So I'm going to talk a little bit about that, but I wanted to talk about the landscape first. So some of these trends around COVID-19, firstly, most of the most viral content has more than, it's basically a kernel of truth, which as we know is the most effective form of disinformation. As humans, if you're more likely to believe something, it's more likely to travel. So why come up with a completely fabricated conspiracy that people might challenge when actually something that sounds really true is more likely to be effective? So we all probably saw something over the weekend, which was like 10 tips from a Stanford doctor. And there it was like gargle with hot water for 10 minutes. Well, that sounds pretty true, or it sounds like it could be true. So that's what we're seeing most of right now, is things that are much closer to the potential truth. Most of this stuff is traveling in closed and semi-closed spaces. So lots of this is in closed Facebook groups. Lots of this is on places like Telegram, WhatsApp, text messages. And that's ultimately because we're going back to, as humans, the people that we're closest to. So right now, many of us are actually living alone, or we're not leaving the house. Many people are frightened. And so rather than taking to Facebook, we're actually taking to one another in our smaller groups of like, oh my goodness, have you seen this? I'm really nervous. What happens if there's a lockdown tomorrow? Have you got enough toilet roll? That's what's happening right now. And so essentially it's like exaggerated gossip as opposed to disinformation. And finally, the platforms have taken tougher action than I've ever seen. I think we have to recognize that when it comes to political speech or even things like vaccines, there's this idea that there's two sides. But with coronavirus, you're not having people like, I want more coronavirus misinformation. So actually the platforms are freer to make kind of stronger steps, to take stronger steps. The question I'd like to see is, are they capturing the data? Are they creating benchmarks so that they can actually get a sense of what these different and stronger measures did in terms of the public sphere? So very quickly, there are 4 categories of online chatter. The first one is disinformation about the cause of the virus. You've got half, as you can imagine, one side of the planet saying it was built in a US lab. You've got another side of the planet saying, no, it was built in a Chinese lab. You've got a lot of conspiracy theories saying that actually it was Bill Gates because he predicted this in 2015 in his TED talk. So that most of the conspiracies are about where did this start. The second bucket is misinformation about how the virus spreads. Lots of kind of misinformation about how long does the virus stay on a surface? You know, will I get this if I, you know, if I've got a dog? But again, this is more just people asking questions as opposed to kind of disinformation. Thirdly, and similarly, mis and disinformation about symptoms and treatment. So we do see some people trying to peddle false cures, certain people trying to sell supplements. No surprises, that always exists. But we're seeing more of, I've been told that if you actually take old malaria tablets that you might have kicking around in your cupboard, that will help. If you take HIV medication, that will help. It's that kind of stuff that we're seeing, which is people just like, I don't know, there's a vacuum right now of information. Can anybody help me? And so that's most of the misinformation. And finally, the majority of the most troubling, I would say, is confusion about government and official response. And the reason that I'm troubled by this is right now, we have WhatsApp messages saying, I'm seeing the army move across the interstate. I've told that there's going to be a shutdown tomorrow. And right now, there's no huge harm with that. This is just people ramping up. My concern is what happens when there are rumors about runs on the bank, that there's no money left in the ATMs, that don't go to that hospital because they've got no supplies. But if you go to this hospital, they do have extra supplies. I just don't think we're quite ready for what it might look like if we have rumors that could lead to offline behavior. And that's what I'd love to talk a little bit more about, is like, how do we prepare for where this is potentially going to escalate? Because right now we're not necessarily seeing a connection with a rumor here and then people taking action. So as you can see, the Bill Gates conspiracy is alive and well. He did an AMA Reddit yesterday. I didn't have a chance to catch up, but I was like, you are a brave man, Bill, to wade into that conversation. The misinformation piece, there's yesterday a lot of chatter on Telegram about there being 2 strains of the COVID virus, that actually the Chinese strain wasn't as serious as the one that Italy and now the US is facing, even though new scientists on the 5th of March said that's not true. We have a thing in the world that I live in called zombie rumors, which is essentially, doesn't matter how many times you debunk it, just keeps coming back from the dead. And so we're starting to see some of these zombie rumors when it comes to COVID. I think maybe a lot of you saw these at the weekend, which is, as you can see, not visual. These are heavy on text, but it's a lot of, I heard this from my friend at the CDC. I heard this from my friend who's a nurse. This is what you need to do. So lots of people circulating right now. And in fact, one of them was, you have to take a deep breath, hold your breath for 10 seconds. If you can't do that, you've got COVID-19. And I just saw a colleague put something in Slack that said that there's actually a UK building that's asking people to hold their breath for 10 seconds before they walk through the building. So there you go. There's an example of a rumor moving into real life. Alex Jones is currently selling these supplements for $90. But again, some of this is just, you know, we should be building up our immunity, take more vitamin C, stop drinking, sleep better. You know, it's hard to argue with some of this stuff. And I'm just going to put my hands up right now and say, I shared this with 2 people I care about on Sunday night. This came into a Telegram group that I'm in, that with people I really, really trust. And you can see at the bottom, somebody actually said, put their finger up and said, this is from a credible source. And I read it and I thought, okay, I'm meant to be an expert in misinformation, but I'm currently living alone. My family are in another country that I can't get back to if anything happens to them. I'm not going to say it right now. It's not a good time to be me, like all of us. And so I saw that and I was like, okay, the 2 people I care about the most in this city, I need to tell them. And I shared it. And of course I woke up on Monday morning and was like, oh, I can't believe I fell for it. The reason I fell for it is because I'm human. Doesn't matter how much media literacy training you've gone through. Right now, this is all about emotion and it's all about fear. And right now, it doesn't really matter what we teach people. What we should be teaching people is, if you have an emotional response, if it makes you upset, if it makes you angry, if it makes you want to go out and buy something to control the situation, that is an emotional response, and stop before you reshare information. And this is global. So these are just some examples yesterday from France and the UK. We're seeing the same messages pop up, but here it might be martial law. In Ireland, it's the army. In the UK, it's national quarantine. In France, it's the equivalent. It's the same message because it works irrespective of, because wherever we are, we're all human. And so somebody sees something working and it happens. And my question is, I don't think that this is malicious. I actually think this is people saying on the phone to each other, hey, guess what? My brother works for the government. He's just come out from a meeting. Like, I'm telling you because I care about you. Like, don't tell anybody else. Like, this is gossip. I don't think it's malicious. I think it's the game of telephone come to life. And if you haven't listened to the Daily from yesterday, I would really recommend it. It's basically an interview with Governor Cuomo. And during the interview, he says, there's not going to be shelter in place in New York. And he says it very clearly. And they come out of the interview, and one of the reporters from New York Times says to him, hey, Governor Cuomo, I heard you say there won't be shelter in place, but CNN is playing right now and saying there's going to be shelter in place. And Cuomo says, well, no, actually, we're going to get a statement to them now, but that's not going to ever happen in New York. And it was this moment of, right now, who do we go to? I mean, we'll hear from Donie. Like, CNN is doing an incredible job. Lots of newsrooms are doing an incredible job, but this is moving so quickly. How do we make sure that people get credible information in real time? And the problem is a lot of government agencies and health authorities don't have the experience to do real-time journalism and breaking news journalism, which is unfortunately what we need right now. I need an hourly update on my phone from the New York City. Like, that's what happened in South Korea. We need regular updates so that people don't have a vacuum, because it's the vacuum that's causing the misinformation. So lastly, very quickly, here are some best practices for slowing down misinformation. Bad actors, people who understand misinformation, understand that outrage and fear works and simple visuals work. The problem is those of us who work in the quality information space, we tend to love text and we tend to love PDF. So here, and I apologize for this image, but I want to show the difference. This is the kind of meme that you see if you are following anti-vaxxers. This is what quality information looks like in the vaccination space. An 87-page PDF, often with a picture of a dripping needle on the front cover. And I'm being facetious deliberately right now because I'm trying to make the point, which is there's an asymmetrical playing field here. And people who understand how to push viral information understand that it has to be simple, it needs to be shareable, and it needs to probably be visual. And unfortunately, those of us who are researchers, fact checkers, policymakers, we tend to love text, we love PDF, and we're not particularly good at creating really engaging, shareable content quickly. And that's what we need. Because there are 4 psychological theories that help shape our understanding of best practices. The first one, familiarity backfire effect. By repeating falsehoods in order to correct them, debunks can make falsehoods more familiar and thus more likely to be accepted as true. So here's an example. Somebody listing all the myths on the left-hand side and then putting the facts. Do not do this, because our brains are lizard brains and we're more likely to remember the myths than we are the facts. And this is proven out in experimental research. So although it's very tempting to say 10 myths about the coronavirus, please don't do it, just because unfortunately our brains are overwhelmed and are really bad at making sense of that. Similarly, this is from the WHO. As you can see, the rumor is in capital letters and is darker and in a bigger font than underneath, which is the fact. They've luckily updated it now in English, but the Spanish site is still like this. We cannot run with rumors bigger and more prominent than we do the facts. And wherever possible, we should only lead with the facts. If you have more space, you can do what George Lakoff calls, which is a truth sandwich, which is to start with the fact, explain that rumors are circulating that say something different, and end with the truth. But remember, if you're just tweeting something out or you're just putting a Facebook post and people only see the image and the headline, you haven't got room for nuance or a truth sandwich. So in that context, try to only lead with the truth. Secondly, the overkill backfire effect. The easier information is to process, the more likely it is to be accepted. Less detail can be more effective. So WHO actually partnered with Pinterest to create these pins. And it feels like we're getting further towards the place we need to be, but there's still a hell of a lot of text on these pins. Yes, it's simpler, but it's not as simple as it should be. And so we've seen some great diagrams about washing hands. We just need to be much better. We need to hire a ton of designers right now to create really simple graphics and illustrations to help people understand. Worldview backfire effect. People process information in biased ways. When debunks threaten a person's worldview, those most fixed in their views can double down. So as we all know, it's quite difficult right now to tell our 70-year-old parents to stay in the house. If you use derogatory language, or you say, hey, listen, I saw you share this on Facebook, but you're wrong, and here's a Snopes article, the person just doubles down on what you've told them. Instead, you'd be like, hey, I saw what you put on Facebook. I've seen a lot of those similar messages, but actually, I feel like people are trying to divide us or scare us right now. And that's not really what we need as a society. It's about we, it's about us, it's about community. It's not about saying your facts are wrong. That doesn't work 100%, I'm telling you. I think you all know this. And finally, this is crucial. missing alternatives. Labeling something as false but not providing explanation often leaves people with questions. If a debunker doesn't answer these questions, people will continue to rely on bad information. So if I say something and somebody comes up and says, no, Claire, that's wrong, a hole opens up in my brain because you told me it's wrong. But if you don't explain why it's wrong or fill in the gap by giving me an explanation, my brain will be like, well, I've got a hole there, I've got to fill it, and I will fill it back with the false information. So the famous example for training is you don't say Obama isn't a Muslim. You say Obama is a Christian, and you show footage of him going to church with Michelle. You have replaced the isn't with, oh, I've got something to fill the hole in my brain. So if somebody's peddling false health supplements, don't just say, you know, turmeric powder doesn't help. It's like, turmeric powder doesn't help, but people are peddling this right now to make money. Oh, okay. But what does help? And I'll tell you what helps. Maybe, you know, and then I give an actual piece of information about what helps treatments. So this stuff really matters because, again, our brains are really lazy and lizard-like, and it's everybody. It's left and right. It's just human brains. And we're more overloaded and scared than ever, makes us even worse at this stuff. So 5 best practices: focus on the facts, make your content easy to process, avoid ridicule or derogatory comments, answer any questions that a debunk might arise, and finally, be precise with language. We're seeing some real scaremongering in headlines right now, and I know that that leads to clicks, we know that, but whether you're a newsroom or whether you're an information provider, we need to do everything we can to dial down the panic. So for example, Twitter Moments every morning tells me how many people have died, but it also tells me how many people have survived. And just adding that context makes a big difference. So the language we use, we need to do everything we can to keep trust high. So actually around trust, there's now reporting today saying that young people actually are being admitted to ICUs. And there's a lot of young people right now on Instagram and Facebook saying, hang on, people lied to me. They told me I was going to be safe, and now they're telling me I might not be. So we've lost a critical moment here around trust because of that particular element. And I'll leave you with this, which is, on Friday, there was quite a lot of rumors saying that the subway was going to shut down. And I saw that and I was like, okay, how are they going to debunk this? And on Saturday morning, the subway tweeted this: hello, everyone. Rumors are spreading. We prefer facts. We will operate regular subway and bus service tomorrow. We're continually monitoring the COVID-19 situation and listening to public health experts. You should do the same. This is pitch perfect. It doesn't say false, the subway isn't shutting down. It doesn't tell you that. It basically, you know, leads with the facts, says keep up, you know, keep updated with us. And actually, they shared it again and said, if you've heard this from your cousin, I don't know who's running their social media right now, but they're doing an amazing job. So that was very quick. I'm happy to answer any questions, but this is complex. And the only way we do this is if we work together to figure out how to make communications work in an age of pandemics. I'm going to hand over to Vivian, and I'll stay around to answer questions.
Claire, that was amazing. And thank you for telling us how, because I think we are all human. And the fact that you, of all people, one of the world's foremost experts, could share something that was false means that that's possible for any of us. And by the way, your comments about the power of simple images and memes, and how that in a way is to the advantage of people who are spreading misinformation. It reminds me though of how the term flatten the curve, which pretty much came from that incredibly simple graphic, which I can't imagine everybody that's watching this now hasn't seen, with the spiky graphic of no intervention and no social distancing, and then the flattened one, with the flattened curve with the line showing the number of beds, how powerfully, and some say that it's a little bit misleading, but it's such a simple message and really resonated. Reminder to everybody, I'm going to ask a couple of questions to Claire. We're going to bring Donie in, but while you're watching, again, there's a Q&A button at the bottom of your screen. Click that and type in your question, and we will get to as many of them as we can. And again, please add your name and affiliation if you don't mind. It's just interesting for us and helpful, but if you don't want to, that's fine too. So Claire, let me just ask one question coming out of that presentation, and then we'll bring Donie on in a second. So a Pew released a poll yesterday saying that the majority of Americans report seeing either not much or no made-up news and information. Again, if you add those two categories, it was greater than 50% about COVID-19. How do we combat the credulity, which we all want to get information ourselves, of people who are seeing what they see online without, and here's part of the thing that worries me, without scaring them so much that they distrust all information that they're seeing, including real information coming from sources.
So I saw that and was really interested. And I actually think it's partly because for the last 3 years, we've talked about the term fake news. So people expect fake news to come from a site that looks problematic. This stuff is coming to them from each other. So I think the challenge there is when you say, have you seen this stuff? They don't think that it's false or misleading. They think it's friends telling them that a lockdown is actually coming. So the challenge is to say to people, be critical, but be critical of each other. And I think what we failed to say is, you know, as I started the presentation, right now it seems pretty innocuous, but what these false and misleading messages from one another could do in 2 weeks' time could lead to panic, violence, and something that I don't really want us to go and think about. But I think if we don't say as a society, only share information you are getting from the government, from a health authority, and maybe CNN. But I mean, that's what I'm saying to friends and family right now, is like, don't share anything else you're seeing, because I'm promising you it's probably going to be misleading.
Well, that's a good time for me to bring in Donie O'Sullivan from CNN. Thank you for being with us. Being with us. This is great, you know, and Claire's answer, of course, gives me a perfect opportunity to ask you, since you cover for CNN not only misinformation, but the political implications of misinformation. How is messaging from the federal government, from federal agencies like the CDC, HHS, et cetera, and particularly from the White House, faring in the information trust front?
Yeah, that's a good question. I mean, I guess what we've seen over the past few weeks, and I guess particularly the past week, is there is good information coming from the CDC and official agencies like that. Also local government. I think, you know, if you see that the New York mayor's office is very active on Twitter and putting out debunking of misinformation in real time. Last weekend, for instance, as Claire alluded to, there was speculation floating around both on text message and on Twitter that New York City was going into full lockdown, full quarantine, and the mayor and the NYPD was out very quickly to try and dismiss those rumors. Obviously, from the White House, I think there has been a change in tone we've seen over the past few days. So I guess hopefully that will continue.
You know, I want to raise something else that was part of your reporting, Donie. Claire mentioned briefly when in talking about the vectors about private messaging. And, you know, Twitter is visible for all of us to see. So when we see these memes coming across on Twitter and sometimes on public pages on Facebook, you know, we know about it. Private messages like WhatsApp are, of course, encrypted and private. And your reporting was about public health officials who are struggling to track the spread of the coronavirus misinformation, and they can't see what's being spread from person to person. So talk to us a little bit what you're seeing and what the platforms are doing about information being spread, again, peer-to-peer.
Yeah, it's been really fascinating to follow this because what we're really seeing here, I think, is templates of misinformation. Okay, where we're seeing the same rumor verbatim, word for word, that's just slightly changed for region or for language. So this week, for instance, we came across a WhatsApp message that made false claims about 4 young people in Ireland who supposedly had the coronavirus. That message was circulating on WhatsApp in English, but the exact same message, only changing location to Toulouse in France, and in Hebrew was circulating among Hebrew speakers. So what we're seeing is the misinformation being repurposed all around the world. And as you say, you know, I think for a long time we've never really, I guess, talked in the past few years about misinformation that spreads through text message, and more so misinformation that spreads on WhatsApp. And I think the question you ask about WhatsApp is very important because WhatsApp is obviously a platform that is now owned by Facebook. Facebook has been very public about the steps it is taking and all the investments it is making, and it's making a lot more investments than other platforms into fighting coronavirus misinformation. But at the same time, WhatsApp, the platform it owns, by design, there is no way to be able to accurately get a picture of the totality of the misinformation which is being shared on that platform, because it is end-to-end encrypted. So I think people get very uncomfortable when we start talking about you know, end-to-end encryption and you know, any way that could undermine that, because obviously people want privacy, they want security. But you know, a lot of these WhatsApp groups are very big. They're more than 200 people. So I think I think as WhatsApp grows and eventually reaches the US market, I think there's going to be, I think that's where we're going to be seeing a lot more of the issues with misinformation. And I think that's where the conversation is going to be moving in the next few years.
The interesting thing is the other part of Facebook is having almost an opposite issue, whereby Facebook, the main Facebook product that most of us are used to, we're accidentally marking legitimate news false. The risk, of course, again, is no one believes anything. In your reporting, are you seeing any lessening in trust of all content?
Yeah, that seemed to be an unfortunate bug for Facebook for a few hours on Tuesday evening. Look, I mean, I think overall, we've seen the platforms like Facebook and Twitter specifically being pretty aggressive in going out there and saying what they're going to do. Twitter just last night announced new rules, additional rules about the coronavirus. So it'll be interesting to see if they actually implement them in an effective way. But, you know, ultimately, as I guess as a benchmark to see how the platforms are doing, Facebook did make a pledge, as did Google about 2 weeks ago, that they would stop accepting ads for face masks because it's causing panic, and it's also could potentially be taking away resources from healthcare workers. There's been multiple reports over the past week of these ads still showing up on the platforms. And I think the defense would be, look, there's millions of ads on these platforms. These are automated systems, and we're obviously going to miss, you know, the occasional ad or two. But the ads that have been showing up on Google and Facebook, some of them literally say coronavirus. Some of them say in plain text, face mask. So, you know, I understand that this is a problem and a challenge that is happening, you know, at an unprecedented speed. But if these companies can't get something as simple as that right, you know, I don't think it inspires a lot of confidence in their other efforts.
Thank you. Yeah. So we're going to now go to your questions. If you see me occasionally looking over to the side, it's because my colleague, Betsy Cooper, is curating the questions that are coming in and them out. So forgive the little head nodding. Reminder, again, the Q&A button is at the bottom. Type in your question, add your name and affiliation if you are comfortable doing so. Claire, a question for you. This one is from an anonymous commentator. You talk about simplicity helps get across messages. That's what people gravitate to. To what extent might simplicity actually exacerbate the problem, given your point that the truth is more complex and requires more text and detail?
Yeah, I'm not saying any of this is easy. And in many ways, it's about pulling people in. And so having simple graphics that are highly shareable is important. But it's about, we need to come up with new skills, essentially, of not just relying on 800 words as a way to capture all the nuance. We need to almost think about how do we make sure in the image and then in the, you know, the first paragraph, we are doing what we can to lead with the facts and then saying, however, please continue reading because we need the, but I think we are reliant too much on language and saying it's complex. Right now, if we don't understand human behavior, which is to just scroll quickly, we're going to lose people. So we've got to find new ways to be simple quickly and to make sure that it's very shareable.
You know, one interesting thing is so far, and we're, you know, half an hour into this, nobody has talked about foreign entities who have these coordinated misinformation campaigns like we so often see around politics. And in fact, Warren Strobel with Wall Street Journal just texted a question to us asking if you have seen any specific examples of foreign-sponsored coronavirus disinformation campaigns.
Well, I'll hand over to Donie. The bigger question is it's very difficult in real time to do this kind of attribution, but maybe Donie has ferreted out something that I've missed.
Yeah, I mean, the challenge here, of course, is that we normally learn about these campaigns 3 or 4 months or 12 months or 18 months after the fact. I think there's, particularly among us in the media, a lot of us have been obviously looking very closely to see if there is evidence of that sort of misinformation, nation state backed. The European Union had a report out earlier this week where they talked about Russia's overt media, like Russia Today and Sputnik, and about how they were sort of, pushing some false narratives around the coronavirus. But in terms of the bots and the trolls, the sort of covert activity that we saw in 2016, right now we don't know anything about, we haven't found evidence of that. That's not to say it's not happening. As I say, we often find out about this after the fact. I will say though, as Claire mentioned, even just among my family and friends, I think people who would not normally fall for misinformation because we're in such a panicked and emotional state. People in the US and in Europe and around the world are perfectly capable of making misinformation themselves go viral about the coronavirus.
The good news, it's pretty easy to do. Julie Smith from Webster University writes in, I teach media literacy and I find my students are extremely cynical about news and information. What advice can you suggest to me?
I mean, on one hand, it's amazing to see traffic go up right now, but I do think that because of all of the discussion about fake news in the last 3 years, it has worked. We've seen research with audiences suggest that many people, when you say what's fake news, they say New York Times and CNN. I do think also a lot of newsrooms haven't necessarily found ways to connect with younger audiences. And again, to think of different formats. I mean, the Washington Post on TikTok is amazing, but I think we've not necessarily taken that audience segment seriously. And as I said in my presentation, there's a lot of anger right now from young people saying we've been lied to about this virus over the last 3 weeks. So you need a few of them for people to say, I'm going to turn to one another because I'm not getting what I want from the news media. So.
And I'm sure media literacy experts, of which I know quite a few, would also say this is a long-term play, not a short-term play. And the more civic education and media literacy, news literacy in the classroom, over time will help kids and then adults and then older adults understand the difference. Next question is from, and forgive me, I'm sorry if I mispronounce your name, but Gulsen Harman, who's a fellow at Nieman Foundation for Journalism at Harvard. What is your assessment of, what is your current assessment of journalism in the face of the pandemic? In your opinion, are journalists passing the tests? Now, I will add my own caveat, which is journalists is an awfully broad term, but I would love to hear what you have to say, Donie. Of course, your exceptional journalism accepted.
Yeah, I don't think I should be grading myself here. I mean, what I think has been very helpful, that we've put on air and podcasts like The Daily has done, is a lot of just answering readers and viewers' questions. And that's something that CNN has been doing. They're doing another town hall tonight with Anderson Cooper and Sanjay Gupta, and where a lot of that is based on just getting people through social media and elsewhere to submit questions and their concerns about the virus and answering them directly. So I think that sort of public service reporting has been helpful, but I think I'd be interested to hear what both of you think, Claire and Vivian.
Well, I'll say I do not want to see another image of an Asian person in a face mask. I don't want to see another gurney outside a building, and I don't want to see another hazmat suit. So I think we've got a problem in that the imagery is stock, and that I don't think is particularly helpful. I'll also say very quickly, I think there's a lot of duplication. So I actually think there's a lot of data voids. There's a lot of questions in real time. Donie, you're absolutely right. Almost every 3 hours, we see new data voids emerging with people with questions. And so how we plug them quickly.
What a data void is.
Sorry, so a data void is work that came out of Data and Society with Dana Boyd, who said, actually, sometimes if you search for something and there's no quality information around it, so for example, do apricot kernels cure cancer? Well, CNN has probably not done a story that says, don't be stupid, apricot kernels haven't cured cancer. So all you see when you search for it is people trying to sell you apricot kernels. So the idea of a data void is when there's an absence of quality information, which is when I said earlier about don't repeat the rumor in the headline, that's actually for Twitter and Facebook. If you're putting content on YouTube and for search, you should repeat the rumor in the headline so that when somebody searches for that rumor, they find quality information. So I would love to see, to Donie's point, much more collaboration with newsrooms saying, lots of people want answers about this. How can we make sure that we're not all answering the same questions so that we can do more together? But I think in the next 2 or 3 weeks, I think the news industry will look quite different in the next 3 weeks. And I think there'll be a forced collaboration to say, you know, we've got to come together around our own resources, which are going to become tighter and harder to find.
We do have several more questions about journalism. I'll just take those now and then we'll move to different topics. Simon Franz, managing editor, BBC Global News. What are the added challenges journalists and news outlets need to address when there is continuously and suddenly new uncertainties to know and worry about at both the local and global level? Donie, why don't you take that as our resident reporter?
I mean, it's to stick to the facts. You know, of course there's going to be new questions every 5 minutes, and I think that, you know, we're all doing our best to try and get answers. But you know, naturally, that there is going to be a lot of unknowns. I think, you know, a big challenge that I think a lot of news organizations have is when there is misinformation in these data voids, and particularly as they're developing, you know, now almost by the minute, is we can see this misinformation going viral pretty quickly. And you know, we're getting it from family and friends, and we're seeing it on Twitter and Facebook and elsewhere. I think newsrooms still, mainstream newsrooms, including my own, I don't think we've figured out a way to know when should we actually go out there with a debunk and a fact check, and when should we not? Because there is a concern that by going out there and doing a fact check on CNN, for instance, that you're actually bringing, you know, you're bringing attention to misinformation that maybe a lot of people hadn't seen, that they otherwise wouldn't see had you not debunked it. So I think that's something that we're going to have to figure out in the weeks and months ahead.
So that, of course, makes sense when you're seeing random information come from anonymous people on social platforms. But Hillary Ross, with the assembly program at Berkman Klein, asks a very relevant question, which is, what do you do when that misinformation is being shared by the government or the White House? I added the White House, sorry.
Well, I mean, we've seen our reporters, I guess, particularly under, you know, this administration for 3 years now, pushing for the truth. And we've seen, I guess, you know, real-time fact-checking or almost real-time fact-checking after a lot of these press briefings where, you know, reporters from outlets all across the country are very quickly following up with sources in government to make sure that what is being said at the podium is accurate. I mean, you can take the example just last week of when Trump referenced this infamous website from Google for people to find information about coronavirus and testing locations. I mean, almost instantly, and it was tech outlets that were first to break it, was that what Trump had said about the Google collaboration wasn't totally accurate. So, you know, it just goes back to the basics of reporting and having to be extremely quick off the mark, I guess.
This would be a good time to shout out to your colleague, Daniel Dale, he and others do extraordinary jobs doing live. If you don't follow him and others like him on Twitter, do extraordinary job fact-checking the statements of public officials live. It's really a sight to behold. We're going to change topics here for a minute. Yael Eisenstadt from Cornell Tech. Hi, Yael. She writes, I'm curious to hear if you are seeing an increase in collaboration between the major platforms. We know that Twitter, Facebook, Google have not been great about sharing protocols, learnings, processes, definitions. Are you seeing a step up in true collaboration? And if so, is there an opportunity to expand this for future efforts?
So I don't know if Donie said,
Probably.
we did see a statement that said there is collaboration, but there was a great piece by Kate Klonik a couple of weeks ago, basically talking about, it's great they say it, but where's the transparency about what that collaboration looks like? What information are they sharing? How are they using it? What are they doing? I mean, one thing I'd say is right now we're in the middle of an amazing natural experiment for the platforms. So if they are taking stronger steps now around coronavirus, they really should be benchmarking the metrics and seeing whether or not these stronger positions are making a difference in terms of search queries, algorithmic reach, all those other things that we never get access to. Right now, they could test some of these stronger measures and at the end of it say, has it made a difference? I would love if WhatsApp right now stopped forwarding. So if I want to forward something, I need to take a screenshot and reshare it. So I can technically do it, but there's a friction built into the system. Like Nathan Matthias from Cornell has done this research. If WhatsApp did that right now, we would have 6 months of data to say, what did that do in terms of levels of misinformation? I would
some forwarding about 6 months ago, but you're saying
they took it from 20 to, like, you can now share it forward to 5. Take out sharing and let's measure it. Like I would love to see more of that. Yeah. So not just collaboration across platform, but with academics. Right now, this is like a moment where we have to say all previous rules are off the table. Let's do new stuff.
I think that forwarding step that WhatsApp took last year is they will obviously say it's meaningful, but I mean, you can still forward to 5 groups at the one time. So you can still forward to hundreds of people, 1,000 people at once. So it's really a bit of a misnomer. But what I would say is I think the platforms, every time they go to Capitol Hill, they tell Congress that they are, kumbaya and everybody's getting along and sharing information. But every time we see takedowns of Russian accounts or Chinese accounts or Iranian accounts from different platforms, we'll ultimately end up finding that very often corresponding accounts so if Facebook does a takedown on a Tuesday, on a Wednesday, or even sometimes 10 or 12 months later, corresponding accounts that's part of that same campaign will still be on Twitter or on Google.
Sets are not being shared.
Yeah, and I think some sharing has increased for sure because there is more coordinated takedowns now, but it's certainly not happening at the level I think that would be conducive to actually having a real meaningful impact.
Wow, we have so many great questions. I wish we could get to all of them. Claire, well, actually, both of you. Danielle Thompson from Columbia asks, have you been able to source the origin points of some of the coronavirus misinformation?
I mean, this stuff is hard. The provenance of how far this stuff spreads. There was a silly video the other day that looked like an Italian patient had escaped a hospital. We were able to go back for 3 weeks. It was on 9gag. It was all over the internet. I mean, so how we track this stuff is really difficult. I'd go back to that point about attribution. Everybody wants to say immediately who's behind this. And we don't know. I mean, I think some of those viral WhatsApp messages, I think it's because somebody calls somebody who's like, hey, Bob, like my brother was just in this meeting. Like, I'm just only telling you, don't tell anybody else. And I just think I don't think it's malicious. I could be wrong. I could, in 6 months' time say I was an idiot, but I don't think right now it's malicious, most of it.
Peter, again, I'm going to mangle last name, apologies. Hartranft asked, with China removing the New York Times, Wall Street Journal, and Washington Post reporters and others, how much can we trust information coming out of China now?
Do you want to take that, Donie?
Sorry. Yeah. Yeah, I mean, today was the first day I think we saw the number of cases in Italy exceed the number of reported cases in China. But yeah, I mean, I think that's a very good question. I think it's something that's been of a concern to all of us since this started back in December. And yeah, it certainly it doesn't inspire, I guess, a lot of confidence in seeing that move. But, you know, there are outlets, obviously, with some reporters still on the ground there. And I guess we'll just have to play it by ear. But I mean, yeah, China is hardly the most, hardly has a record of being the most reliable source of information.
Yeah.
And also, 3 weeks ago, it was quite clear that China was starting to push this rumor that the virus started in the US. And one of our team members who's from mainland China now lives here was saying, watch it, it's coming. You know, we sort of mapped over the last 3 weeks how that rumor has grown and grown, whilst at the same time, the US is pushing the rumor that it started in, you know, as we know, it's called the Wuhan flu. So yeah, there's some diplomatic clashing going on right now.
This question is from Dan Porterfield, the CEO of the Aspen Institute. Hi, boss. He says, he asked the following: one thing I've noticed is that the content of messages, the tone of messages, and the volume of messages all coming in avalanches can create feelings of urgency and anxiety in us as recipients. Often they come at us through digital platforms, which also have sorts of personal emails coming from colleagues, families, and friends. As consumers of streaming information, are there any practices we can use to prepare ourselves to effectively process so much coming at us? I mean, Claire, you're at the epicenter. Well, you're both at the epicenter of this. So much information that you're trying to parse coming at you.
Yeah, I mean, I think, you know, I've set up dashboards to look for the good stuff, dashboards to look at the bad stuff, dashboards to look at the updates coming. But also, I mean, we're all working under incredible circumstances. I haven't spoken to a human being for the last 9 days other than a shopkeeper twice. So the level of stress that we're all under is unbelievable. So I keep telling myself to put the phone down, to stop looking, but I also can't stop looking. So I can't really give advice but I worry about what does this look like as we keep going, because we have to, you know, think about self-care, information, you know, but I don't know how we do it.
Donie, what's your coping mechanism?
Yeah, I think Claire and I are probably terrible people to come to for advice on this. It's really difficult. I mean, I think even more so now that we're all working from home, because, you know, I think when you're in the office, you're more likely, at least I am, to get up from my desk and have a walk around. You know, I think, you know, the only option can be to turn off the phone for an hour or two and pick up a book, or watch something on Netflix that is not about a pandemic spreading across the world.
Actually go outside and go for a walk.
Yes, yeah. And it, you know,
homes mostly.
Yeah, so I mean, I think it's difficult, and particularly in this, over the past week now that we're all just really glued to our devices all day, I think it's just about putting them down, because I think the second once you pick them up, you know, you're going to get it from all angles, right? From social media, from the news, from your friends on WhatsApp and text message.
Yeah, I will just say my own coping mechanism, when we all find our own, is that I channel the stress around all this into, and this may be from, you know, being in the news business for so long, to what can I do? How can I contribute? How can I have an impact? So thank you for allowing me to exercise that impulse with all of you today. But yeah, we all have to find our own comfort zone. Another friend of mine was talking about how they're watching like comedies and doing jigsaw puzzles to try to calm down. I'm the opposite. At night, we're watching like Homeland and Narcos and stuff. So, you know, I don't know what that says about me. We have some more great questions coming in. We only have a few more minutes, so I'm sorry we're not going to get to all of your questions. This is from Alex Joel with the Washington College of Law at American University. Given the non-traditional intermediaries are so influential on social media, expertise focusing on establishing direct relationship with those intermediaries, couldn't direct engagement and conversation make a difference in the information that is circulated? Are we seeing that trend?
You broke up a little bit, Vivian, but I think you were talking about kind of like intermediaries in the community. Was that right?
Yeah. So about health experts and agencies having direct relationships with those who put information out into the world.
Yeah, I mean, I would love to see, as I said, like government agencies and health authorities working much more closely with journalists. Maybe all those amazing journalists that got laid off, maybe we could actually hire them to go and work for these different places. But I think to that point about community, like in the 1980s, the UK had like a Keep Britain Tidy campaign, and it was all about, you know, don't throw litter. I'm really serious right now, like how do we reach into communities and work with faith leaders and, you know, barbershop owners and a whole host of community leaders who can reach people who aren't traditionally consuming the news or other forms of information, or younger people who are the influencers for all these different communities. And I think if this goes on for as long as I think it's going to, what's the form of kind of like the communication tree that means that we're not just relying on major newsrooms, and we're not, you know, I'd like to get an hourly push notification, please, from different, you know, I think we need to think very differently about this, and finding different communities that aren't necessarily traditional news consumers is vital.
Right. And some of the vectors that, you know, that are non-traditional news organizations, but platforms that people engage with around their communities, like Nextdoor and Patch. And in fact, this is a plug to say we're working on some efforts to bring them together with local news organizations and local authorities to sort of come together around what kind of information is fed to local communities. So watch that space. Sorry, plug for our own program. Just two more questions is all we have time for. Dan Barnett from Butte Community College in Northern California. Hope you're staying safe, Dan. How should we address the prevalence of good information, but that is hours or days old and no longer accurate? That's a good one.
That's no longer accurate. That is a good question. I think the only news organization that I've seen do this in a really effective way, I think, is The Guardian, where they have labeled that they've built now in their systems that they put a very prominent label on if a story is, I'm not sure quite how old, but if it's, you know, more than a few months old, they'll put a label on it to say, here's the date of this story. Because sometimes what we've seen in the past, long before the coronavirus, is stories going viral. You know, even actually during the Iowa Democratic primary, before all the chaos, there was a tweet that said Joe Biden has dropped out of the race. And the tweet had actually been from when Joe Biden was running for president more than a decade ago and had dropped out of the race, but people see that fresh in their feeds, and they think it is new news. I haven't seen, you know, I know at CNN we have running a live blog, so that's where we're directing a lot of our audience to go to, but Claire might have ideas of other ways of how people are addressing this.
I would just say it's always been a problem, and now it's absolutely critical. We should have one visual standard at the top of every single piece of content that has a date stamp that should also, you know, in WhatsApp or everywhere. It couldn't be the most critical thing. It is the most critical thing, is what I'm trying to say.
Well, we are unfortunately out of time. We have so many other great questions. We'll find a way to get those questions answered. But I want to thank you, Claire and Donie. We look forward to following your reporting on CNN, and Claire, all the great information you provide on Twitter and other platforms. This webinar will be available for viewing, and we'll be sharing a link shortly. Please check Twitter handle @AspenDigital for that link. We will push it out there. It should be a little bit later today. I also just want to mention we're going to have more webinars coming up soon from Aspen Digital. We're going to be looking at technology and the impact on human connections. We're going to do a deep dive on the platforms that China used during the epidemic, and some other webinars on cybersecurity. Also want to flag that we announced today a challenge grant for technologists working on COVID-19 related needs and solutions. Again, check @Aspen Digital for those links. So thank you so much, and I really appreciate everybody's attention, and stay healthy, stay safe, and don't share untrustworthy information. Thank you, everybody. Bye-bye.